Hi, I'm Ann Fraser. Welcome to another edition of Bringing Hope to Alzheimer's. Today I'm sitting with my friend Jasmine Bell, and Jasmine works for Monarch Hospice, and you are the clinical director or VP
of clinical operations.
There it is. Okay.
Yes.
Okay. VP
Same
of
thing.
Yes, there it is. Okay. So tell us a little bit about how you got involved in hospice care and how long you've been doing it and so forth.
Absolutely. So my background is skilled nursing. So right out of nursing school, I was working in long-term care facilities. And like way back when I was a baby nurse, I saw this common theme of my patients going to the hospital, going back to skilled nursing, rehab, and then going to long-term care, assisted living. And I had so many patients kind of just say, I'm tired of this. I don't want to do this anymore. Maybe my family wants me to keep doing this, but I don't. I'm ready. All of my family has kind of passed. My husband's passed away. And, when you're 21 and you hear that, it's kind of sad. So that was my first experience. I saw hospice in real life and I thought, oh my gosh, that's the solution. Providing that quality of life and that dignified death is really what they wanted. So I kept that in the back of my mind, working more, and then I just realized this is what I'm meant to do. So that's how I got into hospice.
Very good, very good. And so how long have you been in hospice care then?
About full-time, about 4 to 5 years.
4 to 5 years. Mm-hmm. Okay, wonderful. And you guys were a part of the gala this year and the year before.
Yes.
Tell us why you were interested in being a part of the gala, being corporate sponsors, and talk to us a little bit about that.
So I think every part of our organization just has their own story of why they want to be a part of this organization. For me, it was my grandmother. She had Alzheimer's for 15 years. So I saw, the woman who taught me how to read lose that ability. So it's always had a special place in my heart. For other people, I think Alzheimer's is just a growing epidemic, right? And if you have that genetic predisposition for it, it's really, really scary. So any way that we could help provide solutions, we want to. And the gala is a fantastic way of doing that. I love watching it grow every year and being a part of it every year. So
excellent, excellent. We are going to be moving to Lowe's Hotel downtown next year. I know.
About
more
that.
Centrally located to the city. But we appreciate your sponsorship. You guys are awesome,
pleasure.
and we definitely want to support you guys in what you do. And as you know, end of life, those decisions can be difficult. But the biggest thing I see people have the misconception of hospice care is that it's for those last few days or few weeks.
Right.
Talk to me a little bit about that.
So I think it really stems from when hospice was originally kind of put out there. In the 80s, it was started, and it really was for patients who had really short prognosis. So really, they were getting on hospice and getting off, passing away within 3 to 4 days. The Medicare hospice benefit says a patient has to have a 6-month prognosis, right? None of us have a crystal ball on what that means. So if we can prove that this person is making declines in that way, then they can qualify for hospice. So yes, I do see a lot of people that are saying, we want to continue to seek this aggressive treatment because they don't know that there's another option until that last part of life. It's my passion to talk about how you can experience that benefit because we're all paying into it. So why not take advantage of the services that the Medicare hospice benefit has before that last couple of days? Because Medicare hospice benefit is more of a holistic form of care, it really goes with families and talks with them about coping. So it's really hard to do that in the last 3 days of life. You really want to kind of develop a rapport. So experiencing that before that it's pertinent. It's really important.
Right, because it's quality over quantity.
Exactly.
And making sure that the family is all on board is a big part of it. So,
absolutely.
Excellent. How does Alzheimer's disease impact end-of-life care, and what unique challenges does that pose?
It's a great question. I'll start by saying that with every patient, it's very different, right? Alzheimer's looks different. And then if you're talking about the various forms of dementia, I mean, you just have a wide range, right? But what I see commonly is by the time they get to us, the person that was there before is no longer there. So both family and patient have really had to kind of grieve the person before even losing them. So, especially in the home setting, it's trying to create memorable experiences, giving quality to life with a person whose memory isn't there. They can't remember what's going on last 5 days or last 5 minutes. But you have to get creative to be able to really hone in and figure out individually, what can I do for this person to make their experience on hospice or their experience for the rest of their life better.
Mm-hmm. What would you say is the average, the people that you guys are with that have Alzheimer's, what is the average age of those people, would you say?
Oh, it's hard. It is hard because there's so many misdiagnoses too. So Alzheimer's in itself, like I said, my grandmother had it for 15 years. Usually it's very fast or slow progression, right? With other dementias, which they all kind of get categorized the same. And in the world of hospice, we kind of code it as senile degeneration of the brain. And some of them have, a shorter prognosis. But I would say probably 80s, 80 to 85 would be an average.
Okay.
Yeah.
Are you seeing anybody that's younger?
Oh, absolutely.
Yeah.
But I will say that usually it's not Alzheimer's. It is another form of dementia. Vascular dementia is the second leading cognitive impairment diagnoses, and sometimes it's just misdiagnosed. Sometimes a person has vascular dementia. You're looking at all of their other comorbidities, atherosclerosis, you're looking at all those things, and you're like, is it really Alzheimer's? Is it really senile degeneration of the brain? So we do have some people who have Alzheimer's, and a couple, early 70s that have late stage Alzheimer's. So in those late stages, you are really confined to bed. You're not really able to speak. Swallowing is impaired. It's not common, praise the Lord, for us to see that a lot, but we definitely do see it.
Okay. Let's talk about, so as a hospice caregiver, so what resources do you guys provide the family? What do you guys do? How do you coach them along?
Absolutely. So just from the Medicare hospice benefit, it's kind of built in to have more of a holistic approach than other forms of nursing. So you have social worker who's there to really provide that emotional, psychosocial support. You have chaplain, you have your RN, and you have volunteer coordinator. All of them just, and your aide also, all of them just kind of help with the process. You also have different levels of care. So if a person is just routine, you have routine home care. We have nurses that go out at least 2 times a week. Aides, same thing, at least 2 times a week. So you have 4 times that you're having someone in that home. And then with your continuous care, that's when a person's just not settled. So in that Medicare hospice benefit, you have the ability to be there for an 8-hour period of time in a 24-hour period. But care gives them the option to kind of get a caregiver break. And so then they are able to go into like assisted living facility, a skilled nursing facility, and kind of just get 5 days of a break. And then general inpatient, which is kind of hospice house is what people know it as. And that's really for symptom management. So that's kind of built into the Medicare hospice benefit. Outside of that, you really have to be specific to the individual, right? So if you have 2 people who the wife's taking care of the husband who has Alzheimer's, but she's not really able to get up and, make meals. Social work can help with setting up meals. Meals on Wheels is a good one. I like daycares for patients who have advanced Alzheimer's. One, they kind of get that interaction with other people. Usually there's some kind of physical activity, which is really good. And then also that caregiver can get relief. So there's a lot of creative ways. I would say the biggest thing with hospice is it's all individualized to that person and what they're needing.
So for someone that is younger, because as I don't know if you remember the statistic I said at the Gallup, but in the last year, there's been a 200% increase in early onset, what we would call dementia, Alzheimer's, whatever. So that's from ages 30 to 64. What would someone who's not on Medicare or Medicaid, what happens in those scenarios? I know people in their 40s and 50s who are in end stages.
Right.
What does that look like?
Yeah, so it really looks like finding them where they're at. I had a patient long before I was even in hospice. Actually, I was a CNA at the time. He was 45, just got engaged, never been married. I think he had a form of dementia, very fast progressing. But what we kind of did for him was create a makeshift wedding for him. Called in a chaplain. Being able to provide that individualistic care, I think, is very important. But also, especially in those stages, trying to keep them as active and participating in activities of daily living as possible. And again, you have to get really creative in that, right? So our volunteer coordinator, she's fantastic, but she actually was a yoga instructor. And sometimes she goes to memory care places and provides yoga classes. Things like that help kind of retain some of that memory and just add quality to life.
So let's switch directions for a moment and say, so a family has a loved one in hospice who's suffering from some form of dementia, whether it's Alzheimer's or vascular or whatever, and maybe they know that there's a genetic component or they don't, but they're scared about it, which is very normal.
Right.
Is that something that you talk with them about? Do you talk with them about getting a healthier brain? What does that look like for you guys?
Absolutely. So one thing I would say is definitely find a neurologist, find a team of health professionals that really understand what you're going through and are going to have your back. But everyone just, all the common things, right? Lifestyle choices, not smoking, eating right, exercising, all of those can help prevent Alzheimer's. But again, diagnostically finding out where you're at, and I know you talk about this a lot because you kind of went through this, finding out where you're at and then making sure that you implement the things that, like lifestyle changes that can help, and then following up and see where you're at afterwards. I think that is very helpful. But first, I always say, find a good team. KU has a great team of neurologists. Find a great team that you can start, just like a primary care doctor, right? Just on your brain.
Okay, very good.
Yeah.
What have we not covered today that you would like to bring attention to, especially about Monarch Hospice and what you guys do, especially in the realm of Alzheimer's and dementia?
Absolutely. So I think being educated is the biggest thing that you can do. Just knowing the symptoms to look for, knowing how to react to those symptoms. So education is really big for us. We try to have all of our clinicians get be certified dementia practitioners and NIDE certified, just so that they have a basis to that understanding. My first job, I was a certified nurse assistant at the age of 17. My first job was in a memory care setting, and it was specifically behavioral memory care setting. So I was able to see kind of the extremes of Alzheimer's and dementia, even the extremes of what medications can do, your antipsychotics can do to people with Alzheimer's and dementia. So I knew kind of how to react. I knew how to de-escalate. I think what we do differently at Monarch Hospice opposed to other places is just prepare our clinicians for what they might see so that they can better impact other people's lives.
Very good. Very good. I love that. You guys are awesome. I appreciate you being here. And in Kansas City, Monarch Hospice is one of the leaders in great hospice and palliative care. And I appreciate you coming today.
Thank you so much.
Thank you.
It's my pleasure.
Absolutely.
Yeah.
So if you have any questions for Jasmine or for myself, please reach out to us. We'd love to hear from you. And thanks again for tuning in to Bringing Hope to Alzheimer's. Take care. Thanks.